It makes things easier to cope. As far as I'm concerned, I'm home. I've been in hospital several times in the last few weeks, unfortunately, but luckily now I'm coming to the end of treatment, but also I'm able to be treated at home, which is a big relief when it's gone over so many weeks. So it takes the pressure off for home for me. To come home after you've been in hospital for a while, first of all it feels very strange because you've been relying on somebody to do everything for you, telling you whether you can go to the toilet or to whether you can have a cup of tea and how long you've got to wait for that anyway. And so, first of all, when you come home, you think, oh, who's going to do that for me now? And then you realise that's what your husband's for. But of course, it's got to work. It's got to work both ways. And it's lovely to come in your own front door and be able to think, I can relax because it's us.
So patients are absolutely loving being able to go home, quite understandably. So they're loving being able to have their treatments at home, particularly with the IV patients where maybe they're on really long courses up to 6 weeks. That's a long time to spend in hospital if actually, generally any otherwise, you're feeling okay. Patients are feeling that actually daily phone calls are reassuring enough. They're actually happy for that input. They feel like that's actually enough for them. What I've learned so far is that I'm managing quite easily with the electronic side of it. I'm supported well. The staff come and help me if I need it at home, and also if there's anybody needing to give me any advice, I can phone up and I can get it straight away. There's always somebody who seems to be there for you. It's good that the nurses came in as they did the other day, and it's going to happen again this week because I believe I've got to have blood taken again this week.
Our virtual ward is helping reduce inpatient stays for patients that could be managed in their own environment. Given feedback over the last few years from patients, they would prefer to be in their own environment receiving their treatment. And given the pressures within hospital on acute services for attendances to the emergency department and to same-day emergency care, people want to be looked after at home. This winter, we will aim to have 50 patients on our books, and that, when you put it into numbers, is 2 wards full of patients that are being looked after in their own home. That can only be good for them. When you arrive at the hospital, everybody's very professional, as you would hope. The problem being that you get there and there is a queue of ambulances because the pressure on the emergency system is very high. I've been sat for hours in the car park, as have many people, and I know that when I get in there to be dealt with, I will be sent to the area which is more appropriate for me. But in the meantime, the reason why I'm held up for however long it happens to be is because there's a bottleneck at the other end, and I would hope that this would be a way of easing that bottleneck. So instead of there being 20, 30, 40 people waiting to have their blood pressure taken and their general health checked, instead of taking up a bed for that, that this equipment that I'm now trying out would be available for them to be able to go home and press a button or do whatever they have to do and feel as confident as I do.
We've had some really great feedback from patients. We've been lucky to use our volunteer team to follow patients up after they've been on the ward, so they're having telephone conversations with all of them. We obviously follow the friends and family system that the hospital use, and we've had 97% of patients say that their care was very good, all good, and that has given the hospital back 2,333 bed days.
Well, I've got a son and a daughter, and they both do as much as they can do. They both work full time. They come when they can, and they know that they're not having to wait until visiting hours, and they're not going to have to try and get up to Derriford and try and find a parking space. So if they've got 10 minutes that they can pop in and see mum, and hopefully dad as well, then that is going to be 10 minutes with us as opposed to 10 minutes up the road and then another 10 minutes to find this and that. So hopefully that means that they feel less pressure and are able to come and we become a family again.